A new day, but it will be as yesterday. The same routine, the same people, the same places. What will I wear? Nothing. What will I do today? I won't do anything. I won't meet anyone. Woke up. The phone is ringing.
Don't answer.
You should answer.
Don't answer.
I don't want to speak to anyone.
They will kill you. You are stupid.
Stupid.
I won't answer. Who control my life? I'm not free. I can't be free. I'll take some coffee.
Don't drink. No. It's poison.
I will die.
Why didn't you drink? It is good. It would make you alert.
I'm tired.
Hello everyone. Today we will talk about a very common mental illness. About 1% of people are suffering from it. Yeah, we will talk about schizophrenia. Schizophrenia is a Latin word, consists of two parts. Schizo, which means splitting, and phrenia, which means the mind. That means the splitting of mind, or rather the splitting of thinking, or instability of thinking. I noticed a very common mistake. Most people think that schizophrenic patient has many characters. Every character has a specific time. Like if you meet him today, tomorrow you will meet another person who is completely different from the person you have met before. That's not correct, as schizophrenia means instability and splitting of thinking, not splitting of personality. Then what about the person who have more than one character and we watched him in a lot of cinematic movies? There is a completely different disease which is called dissociative identity disorder, which is used to be called multiple personality disorder. This disease is characterized by the presence of at least two personalities in the patient's mind, and these personalities are different from each other and relatively permanent. And we will talk about the disease in another video, as it is completely different from our topic, which is about schizophrenia. Before we start, I hope you hit the like and subscribe buttons and turn on the notification bell. What is schizophrenia? Schizophrenia is a syndrome which has some specific symptoms like disturbance of thinking, emotions, feelings, and behaviors. You can say instability of the patient's character. He don't have more than one character, he has only one character, but it's disturbed and unstable. We can divide schizophrenia symptoms into three main groups: positive symptoms, negative symptoms, and cognitive symptoms. We will start with positive symptoms, which are new symptoms that occur in the patient's personality and he was free of them before. And any normal person is free of them. I mean, they are abnormal changes which occur in the patient's thinking. These symptoms are like delusions, hallucinations, disorganized speech, disorganized behavior, and catatonic behavior. We are about to discuss every symptom. Let's start with delusions, which mean that the patient is convinced of things that are not true. There are many types of delusions, like delusions of control, which mean that the patient thinks that there is someone like an alien that controls everything in his life. Another type of delusions is delusion of grandiose. Here the patient feels and think that he is the strongest and most talented human and he has a lot of knowledge. Briefly, he thinks that he is the greatest person in the galaxy, if not in the entire universe. Another kind of these delusions is orthomanic delusion, which means that the patient thinks that there is a famous and important person loves him, and the patient imagines pleasant situations occur between them. In fact, they are far from each other, and they haven't even met each other. There are many other types of delusions, and the patient may suffer from more than one delusion at the same time. The second type of positive symptoms is hallucinations, and it's divided into two types: auditory hallucinations, which means that the patient can hear not existed sounds and voices as if there are people talking to him, and visual hallucinations, which mean that the patient can see not existed things or people. The patient may suffer from both types at the same time, as he can see and hear not existed things and people. The third positive symptoms is disorganized speech, which means that the patient say things which are not related to each other and they not arranged. For example, he may say, the book, the car, I wanna drink some coffee, I'm hungry. And disorganized behavior means that the patient may do unlogic behavior, like he may wear heavy clothes in the summer. The last positive symptom is catatonic behavior, which means that the patient may do unusual movement without a reason, or he may stay immobile for a long time, also without any logic reason. The second main type of schizophrenic symptoms is negative symptoms, which mean loss of reactions and normal actions, which are the opposite of positive symptoms. As we said, the second main type of schizophrenic symptoms is negative symptoms, which mean loss of reactions and normal actions, which are the opposite of positive symptoms. As we said, positive symptoms are new things would be added to the person's character and thinking. Briefly, negative symptoms are loss of normal things which would be present in the thinking and the mind of any normal person. For example, loss of the ability of making expressions or feeling, which means loss of emotions, as he may doesn't be happy when he succeeds, or he doesn't be sad when a bad thing happens. And if the case progressed, mixing of emotions or feelings would occur, as he may feel happy when a bad thing occurs, and the opposite is correct, as he may lose the ability to be surprised or excited. For example, if he saw a lion while he is eating in his living room, he would continue eating without any surprise or reaction. He also may suffer from alogia, which means decrease of speech, as if you asked him, "You have children?" he would say, "Yeah," instead of saying, "Yeah, I have a boy and 2 girls." And he may lose the interest of the entire life. He may prefer being alone at home. He don't try to go out and making friends or finding a work. The third main type of schizophrenic symptoms is cognitive symptoms, which means that the illness is affecting the memory, learning, and understanding, which lead to decrease in the ability of learning or remembering even easy things. Now, after we explained the symptoms of schizophrenia, we should know that the symptoms don't occur at the same time. Usually, schizophrenic patients should go through 3 phases. The first is the prodromal phase, which is the beginning of the disease, in which the patient prefers being alone. It's like a phase of depression. The second is the active phase, in which the patient would suffer from positive symptoms, like delusions, hallucinations, and disorganized speech and behavior. The third is the residual phase, in which we can notice the residual of symptoms. And in this phase, the mental abilities starts to decrease. The condition may improve in the residual phase, and in this case, we call it recovery phase. The patient may go through these phases as a cycle, as after recovery, he may return to the prodromal phase, then the active phase, then the residual or recovery phase again and again. That means that the patient may live in a cycle of progression and regression of the disease. How we can diagnose schizophrenia? To diagnose schizophrenia, the patient should have 1. Delusion, 2. Hallucinations, 3. Disorganized speech, 4. Disorganized behavior, 5. Negative symptoms. And at least one of these 5 symptoms should be from the first 3 symptoms, which are delusions, hallucinations, and disorganized speech. That means the 4th and 5th symptoms alone, which are disorganized behavior and negative symptoms, alone can't diagnose schizophrenia. And these symptoms should continue for at least 6 months, and at least 1 month of these 6 months should be the active phase. And before we diagnose schizophrenia, we should exclude some similar diseases or conditions like drug abuse, some types of epilepsy, any other mental illness like depression and encephalitis. Then, what are the causes of schizophrenia and who are the risk group of people? Simply, schizophrenia results from disturbance of chemical substances in the brain, like neurotransmitters. A lot of recent studies have proved that it is caused by increased dopamine levels in the brain. And the most effective drugs in the treatment of schizophrenia are those which block dopamine receptors in neurons, which called D2 antagonists. So they decrease dopamine level in the brain. However, one of the most effective drugs in the treatment of schizophrenia is clozapine, which is a weak D2 antagonist. So we think that there are other neurotransmitters which are related to schizophrenia, like norepinephrine, serotonin, and GABA. Recently, scientists have discovered that there are specific genes presented on specific chromosomes, and they are responsible for disturbance of brain chemicals. That means that the disease has a genetic base and may be inherited to children or grandchildren, especially if the parents are relatives. And there are some environmental factors which may be related to schizophrenia, as some infections. There are some kinds of viruses can cause schizophrenia, and also there are some immunological diseases like celiac disease may cause schizophrenia. And before we know the management of schizophrenia, we should know the prognosis of the disease. About a third of patients are completely improved, which mean a regressive course of the disease. And the second one-third stay stable without improvement or progression of the disease. That means a stationary course of the disease. And the last one-third, their condition is going worse, which means a progressive course of the disease. What about management of schizophrenia? How we can treat schizophrenia? Treatment of schizophrenia are divided into two main categories: psychological and social treatment and biological treatment. As we know, psychological and social treatment lies in the psychological support. Biological treatment is divided into two main categories, which are drug treatment and electrocompulsive treatment. Let's start with drug treatment. Most of these drugs are antipsychotics, even conventional or typical antipsychotics like chlorpromazine, trifluoperazine, and thyroidazine. These drugs have a specific effect on the positive symptoms like hallucinations and delusions. The patient should also take anticholinergic or antiparkinsonian drugs like Parkinol or Cogentin in order to decrease the extrapyramidal side effects of the antipsychotics. Another side effects which may occur are mouth dehydration, nausea, constipation, heartburning, jaundice due to allergic liver response, and postural hypotension, which means decrease in blood pressure when the patient is standing suddenly from supine position. And some other side effects like cyanotic attacks or even poisoning with high doses. These side effects are rare, especially with right dosage. As for electroconvulsive therapy, in this type of treatment, we use electrical waves and impulses to stimulate some neurons to redistribute and rebalance brain chemicals. We use this type of treatment with highly progressive cases or cases which are suffering from another mental illness like depression, or the cases which are refused to take the chemical drugs, or even when the chemical drugs fail. Finally, we should offer the psychological support to any person who is suffering from schizophrenia or any other mental illness. The mental illness isn't the patient's fault, and every psycho patient should visit a psychiatrist. And this video isn't a reference of diagnosis or treatment. And no one should take any drug without a doctor's prescription. And if you are one of the heroes who completed the video, don't forget to press the like and subscribe buttons and turn on the notification bell to reach every new video as soon as possible. Goodbye.